Recording last. Okay, sir, we are live now.
Good afternoon, dear colleagues. I am Dr. Rahul Mehrotra, Director and Head of Non-Invasive Cardiology at Max Super Speciality Hospital, Saket. Today, I'll be briefly talking about the role of meditation in cardiovascular disease management. I'm sure for most of you, it will come as a surprise that meditation is recommended by most of the World Health Authorities and even cardiovascular health authorities, because it has now been scientifically proven that most of the risk factors that are responsible for influencing or causing a heart attack can be managed effectively by meditation along with other lifestyle measures. It not only ensures that on its own, it will bring down your heart rate, your blood pressure, it will help get rid of bad habits like smoking. It will help improve our willpower, and thereby we are able to take life modifying behaviors and improve our diet, improve our exercise behavior. But in it also supports other lifestyle measures which we recommend, like physical activity, dietary control, regular sticking to medications, etc. And there have been systematic studies based on which, for example, American Heart Association almost 4 years ago recommended meditation to be discussed with all patients for high blood pressure. It is as effective as salt restriction, physical exercise, or diet for bringing down blood pressure if we incorporate meditation in our regular daily life routine. Similarly, the American Heart Association also came out with a statement in 2017 where it talked about meditation for prevention of overall cardiovascular disease. So, based on the evidence, they gave a recommendation that all patients should be recommended this, and all people can be recommended that if they include meditation in their day to day life, then it is now scientifically known that this will help bring down the risk of occurrence of cardiovascular disease. So, based on these recommendations, we are now very happy to share this information with our patients, with general population, that meditation is a scientific tool. It is very effective and it is being studied for most of its benefit. And only after extensive studies, we have now begun to recommend it to our patients. Besides, there is no side effect and it is extremely safe also. I speak as a cardiologist, as a doctor, but also from personal experience being an avid meditator on my own. So I have been a practitioner of the heartfulness system of meditation, which is freely available worldwide, offered free of cost to anybody and everybody who is interested in trying this out. And I have been practicing this system for more than 2 decades now. And I have also been a trainer for more than 5 years now. And personally, it has been a life transforming experience for me. But also, we undertook several research studies, and there are some of the research studies which are all just ongoing right now, based on which we are very confident in recommending meditation practices, particularly simple, safe, effective, widely available, easy to do practice like heartfulness meditation practice to all our subjects who come across high cardiovascular risk, as well as people who are so-called healthy right now and who do not have any disease. If we incorporate meditation practices in our daily life, we will notice the numerous benefits that it offers, not only in terms of overall well-being, like sense of peace, sense of calmness, inner joy, happiness, being poised, but it also translates into less risk of high blood pressure, reduction in heart rate, as well as overall reduction in the risk of cardiovascular disease. Not only this, We have seen by several studies that if it is offered to patients after they have had a heart attack or a stent or a bypass procedure, then also as part of a rehabilitation program, it has been shown that it reduces the risk of recurrence of future events in these subjects. In a very good study from Africa, it was shown that if meditation is made part of the rehabilitation program after bypass surgery, then the risk of recurrence at the end of 4 to 5 years was reduced by almost 50% compared to people who were not given the advice on meditation and only talk was about diet, physical activity, regular medications. So, as an add on to existing measures that we are already taking, it is a very useful, very safe, and very effective remedy to incorporate in our day to day life. So, having seen the benefits from our own personal lives, we are now happy to share this information from the scientific world that numerous studies are being undertaken, and some of the studies already that have been undertaken have shown very clear results of the benefits of this meditation practices on our overall well-being and cardiovascular health. But this does not mean that we stop taking our medications, we stop following the other advices that are given to us. As a doctor, I will urge you to continue taking your medications and add this aspect to your lifestyle. Much less talked about aspect, much ignored aspect of lifestyle modification, meditation to a daily routine, and you will see it benefiting you in terms of overall health and well-being. We at Max Institute also undertook a study in collaboration with Indian Institute of Technology, Delhi, our neighboring institute, IIT Delhi, and we examined these heartfulness meditation practitioners, 30 of them, for what was happening to their heart rate, blood pressure, heart rate variability when these people were doing heartfulness meditation in our lab, and they were doing a heartfulness practice which we call cleaning in our lab. So we noticed that as these people meditated, their heart rate went down significantly, their blood pressure reduced significantly, and when we did psychological scales studies on these patients, it was shown that more than 80-90% of the people found the experience very relaxing, enjoyable, calming. And most remarkable was the change in heart rate variability. So he switched over from a sympathetic dominance tone to a parasympathetic dominance tone, which meant that the meditation practice resulted in a change in the nervous system. It resulted in a switch from sympathetic to parasympathetic autonomic nervous system. And parasympathetic nervous system is much better to be in most of the time of the day because it keeps us calm, composed. Most of the body is relaxed if we are in parasympathetic dominant tone. So this was a wonderful study, which also won an award at the international level for the best scientific research paper on meditation and cardiovascular disease. So this is just one of the study I could share. It was our own personal experience, which was a published study in the premier cardiology journal of our country also. So there are many such evidences from across the world which are accumulating, and it's high time we started taking meditation as a serious practice, something that can be easily incorporated in our day-to-day lives. And it not only has spiritual benefit, for which it was primarily used and recommended, but it also translates into good health, a sense of well-being, and a balanced life. So I will encourage all of you to take this opportunity, practice heartfulness meditation. You can visit the website www.heartfulness.org, gather more information, find a trainer. Very easily, you will be able to incorporate this in your daily life in spite of the most busy schedules that you can have. If there are any questions related to the presentation just now, please feel free to ask. I'll be happy to answer. Thank you so much.
Sir, am I audible?
Yes, please.
Sir, someone having a question that is meditation a primary prevention in
Very scientific question. So primary prevention, yes, and also secondary prevention. So I mentioned a study where patients after bypass study have been studied after bypass operation. And once they were offered meditation, the risk of recurrence in people who did meditation was almost 50% less at the end of 4 to 5 years. So this was a demonstration of secondary prevention. While all of us who do meditation and we show that we are able to prevent cardiovascular disease as compared to people who are not meditating, this is primary prevention. So it is for both primary and secondary prevention. Yes.
okay, sir. Sir, there is also one question that meditation can hypertension be cured naturally?
So as I mentioned, we have to be very cautious in our approach and we should not make any such claims that meditation will cure most of our diseases or anything like that. Just like we recommend salt restriction because it reduces blood pressure, we recommend a particular type of diet rich in fruits and vegetables, salads to bring down blood pressure. We recommend physical activity, exercise, and avoiding cigarette smoking, sedentary lifestyle, alcohol for bringing down blood pressure. So these are lifestyle measures which are known to reduce blood pressure and help the drug therapy more effectively. Similarly, meditation is also shown to reduce blood pressure to the same extent. So it is a lifestyle measure, it is an add-on measure, but it is not so that your BP problem will be cured without
Yes,
drugs.
sir, yes.
Most
Yes, yes.
patients, if they require drugs, they should continue to take drugs. And if you also have a healthy lifestyle, including all these measures and meditation, then probably the progression of the disease will be much slower. The dose requirement of your drugs will be much less, and the complications will be much less. So it is an add-on therapy. It should be discussed with all our patients. We do that. And it should be practiced by all of you, but do not expect and do not please stop your medications, drugs, thinking that this itself will be curing your blood pressure.
Thank you, sir. Thank you for kindly giving your precious time and your valuable, informative talks on hypertension and its management, sir. Sir, there is one more question for you, sir. Sir, with the help of meditation, is this also reduced? Suppose is somebody having their family background, historical hypertension. So, sir, meditation also help to reduce the patient to having a hypertension?
Yes. So even if you have a family history of high blood pressure, heart disease, it does not mean that you will necessarily get high blood pressure or heart disease if you have a family history. It predisposes, but it does not 100% causes high BP or hypertension. And it has been shown that if you regulate your lifestyle, a very disciplined lifestyle, then in spite of a family history, you will not get high blood pressure or cardiovascular disease. So yes, meditation and a regulated lifestyle will help prevent even in this scenario.
Sir, thank you very much, sir. There are no more questions, sir. Thank you very much for giving your precious
Thank you
time
for
and
the
valuable
opportunity.
talks. Thank you, sir.
Thank you.
No, sir, it's our pleasure, sir. Thank you. Have a good day, sir.
Thank you.